Welcome and thank you for joining me. We're going to be addressing headache pain, both from tension headaches as well as from sinus headaches, even migraines, with some acupressure points and a little self massage. So, quick question. Our topic today is headaches and headache pain. Is that something that you have a tendency to experience? And if so, how often? Started. And of course, we'll get started by centering ourselves and grounding ourselves for a few moments. So go ahead and close the eyes. Take a couple of deep breaths, letting out a big sigh on the exhale. Ah. And again. Ah. One more. Ah. Just settling into your body, noticing how it feels in this moment. Today's class on headache pain, whether you're addressing it for yourself or as a way to help others. Typically, deep breathing can be very beneficial. Just invite yourself or invite your client to just stop and pause and take a few deep breaths. We're going to be using acupressure points today, and deep breathing while applying pressure to those points also really helpful. So as we like to start our class with an Om salutation, go ahead and bring right and left hands together in front of heart center. And on your next deep inhale, we'll exhale into Om. And take a moment to set your intention for this day. What do you need? What do you want? And sealing that intent with one more Om salutation. Om. When you're ready, slowly opening your eyes. So before we do any body work, always good to center ourselves, the sounding, the breath, and we'll do a little bit of movement so you can do this just completely comfortably seated. We're going to take a mini Tai Chi ball and just imagine a ball of energy between our hands and slowly inhale, expanding that ball of energy, and slowly exhale, contracting that ball of energy. And connecting your breath to the movement of your hands. It's one of the quickest, easiest kinds of energy building exercises that you can do. Great to do before you work on yourself or on any client. And on the next time you condense your hands, kind of turn them around each other. See if you can really have a palpable feel for that ball of energy. And then we're going to play with expanding up to the diagonal and down. Switch to the other diagonal. And now putting one hand down, one hand up. Switch hands. And coming back to center, circling those hands. And then just holding steady, close the eyes, breathe. 3 deep breaths. Good. And go ahead and shake your hands out. And just notice, how do they feel in this moment? Do you notice any difference? Do they feel a little tingly, a little warm? Good. All right. So we're ready to begin some body work. Typically, headaches present themselves in a couple different ways. A typical normal headache, a lot of times caused by tension, Liliana mentioned stress as a cause, will come up the back of the neck, over the top of the head to the forehead area, and typically will be felt from the back of the neck tension all the way up and over, and may feel like a whole head kind of sensation. So for those kinds of headaches, we want to work a lot in the base of the skull and the base of the neck. And this would be a typical tension headache caused from stress. Other kinds of headaches may present themselves around the eyes and around the sinuses, and a lot of times are connected with the sinus as a sinus headache. So that might be related to a cold or a flu. It may be the allergies, the environment may be causing something around the sinuses. And so for those, our points are around the eyes and the nose to help to relieve those. The other would be a migraine headache, and migraines present themselves in a variety of ways, sometimes with pain, sometimes with other symptoms like nausea or visual disturbances, blurred vision. And so both of these kinds of treatments, both for the tension headache and the sinus headache, can often help with a migraine, although migraines sometimes just need time. So all of these techniques we'll do with some deep breathing techniques to help address those. So our main point for headache pain is large intestine 4. So between the thumb and the forefinger in this fleshy part, and I'm going to turn so you can see my hand better. So right where my thumb is, for this point, typically it's easiest to place a finger and thumb on either side of the hand, and then depending on how tender the point is, if a person has a headache, it's going to be tender. You can do a variety of techniques to address that. So our first technique with acupressure is a pulsing technique. And so you can press and release, press and release, press and release in a pulsing kind of fashion. And typically you might do 5 or 10 press releases on the point. Now, if it's not too tender and a press release is tolerable, you may want to try rubbing it out. So a circular motion on the point. So circular motion on the point. And that may be tolerable as well. And that is a little bit more intense typically than the press release. And then lastly, if you can hold it with steady pressure, that's actually the best to address the acupressure points. And you can breathe deeply. Sorry for any noise. Breathe deeply as you hold this point. Turning my hand around so you can see, hopefully. Let's do it this way. Here we go. There we go. Good. And what you do to one side, you want to do to the other. Typically, if one side of the head hurts more than the other, that same hand will also be more sensitive than the other. So Again, finding this point between the thumb and the forefinger, large intestine 4. Let's see, here we go. It's being really weird with our virtual background. So right here, and if you press around till you find a tender spot, that usually means you're on it. And then we'll pulse 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We'll try rubbing it out in a circular motion. And then we'll hold it with steady pressure and do some deep breathing. Now this is a very potent point. This is Hoku, joining of the valley. This point is contraindicated during pregnancy. It does cause energy to descend in the body, which is why it will help a headache. It'll help draw the energy out of the head. But we don't want anything descending in pregnancy until it's time for labor and delivery. So I'm holding with steady pressure and I'm breathing and I'm talking, because ideally a whole minute to even 2 minutes, ideal for holding a point. Now this is so potent, this point, that it really addresses pain anywhere in the upper body. It's a very potent point. So just holding this point, I have friends, clients who will say, oh, I have a headache, and I'll just immediately go and grab their hand and press on their point. So just holding that and breathing, inviting them to do some deep breathing. All right, so that's our potent point, and that's for any kind of headache pain, whether it's migraine, whether it's sinus caused, whether it's tension headache. All right, I'm going to turn around so you can see the points that we're going to work on for the tension coming up the neck over the back of the head. And maybe I'm going to turn around. There we go. All right. So we're going to find the little indentation right at the base of the skull where the nuchal ligament comes out, nuchal notch, and we're going to press up and in. So vector is kind of up towards the eyes. And again, if it's really tender, pulse it, press, release, press, release, press, release. If you can hold it with steady pressure and circle, that's going to be a little more intense. And if you can hold it with steady pressure and breathe, that's the best. Now, just to the side of that point, so if you find that point and follow the base of the skull to the side about 1 finger width, you're going to find 2 more points, and we're going to press there. Now, for yourself, when you're doing it on yourself, it's really easy to just place your thumbs there and lean your head back to provide pressure. So lean the head back to get pressure there. Really easy way to do self-massage for you. If you're working with a client, you can have the weight of the head with your fingers underneath at the base of the skull. And I am pressing right up against the occipital ridge here as I'm pressing. And deep breathing. Now there's a couple more points just down from those points. So about 1 finger width down, you're going to find 2 more points. So again, pressing in and leaning back allows you to provide self-massage for yourself on these points. And then just to the side of that, again, about 1 finger width out laterally, you're going to find another set of points. And go ahead and press there and breathe. Excellent. All right. So let me show you the handout for those points. So these are, if I can, yeah, here we go. So these are the points we just worked. We worked governing vessel 16, gallbladder 20, bladder 10. Okay, now we've got another great point. It's halfway between the base of your neck and your acromion. right in the center at the very top of the shoulder, and this is gallbladder 21. So again, you can pulse here, you can circle, you can hold with steady pressure, and breathe. Now, gallbladder 21 also contraindicated during pregnancy, again, because of the same reason. It causes energy to descend in the body, and it helps to pull the pain out of the head. Good. Let's go over to the other side. So find that midpoint right between your acromion and the base of your neck, right in the middle there. And it's right at the very top crest of the shoulder. And again, we're pressing. So here I'm pressing with my fingertips. See that? Yeah, there you go. Good. So these are all tension, stress points that really help to relieve that tension kind of headache. All right, good. And shake that all off. And notice how you feel. Take a couple breaths, close the eyes. If you had any headache pain, hopefully it's diminished. If you didn't have any headache pain, hopefully you feel a little more relaxed and soothed. Now, for sinus kind of pain, also helpful if you're having a headache from eye strain. If you've been looking at the computer or screen too long, this will often present itself similar to a sinus headache with pain around the eyes and sinuses. So for this, we're going to start with our third eye point. So right in between the eyebrows and up just a little bit. This is governing vessel 24.5. And again, you can pulse it, you can circle it, and you can hold it with steady pressure. And deep breathe. And then we're going to find the bridge of the nose and go right up against the supraorbital ridge of the eye socket. Again, if it's too tender to hold steady pressure, pulse it. Press, release, press, release. If you want to circle, that can stimulate the point, or just steady pressure. And then we're going to come to the outside edge of the eye and press here. Again, we're pressing against the orbital ridge. You could even hold these points for as many as 3 minutes. Typically 1 minute is good. And then there's a point just directly below the eye at the top of the cheekbone. So you're on the zygomatic arch and pressing against the bone. Good. Then follow the edge of the nose into the little indentation on either side of the nostrils. And here you're going to press in and kind of towards the nose at a diagonal. These points actually are even helpful if you've got a client who was face down and gets congested. They turn over. You can work these sinus points to help open the sinuses just as relief from being face down on a massage table. Then we're going to slide below the cheekbone, about 1 finger width, so 1 finger width out from the nostrils. And now we're going to be pressing up and in. So we're kind of below the zygomatic arch here. When we were at the base of the eye socket, we were above the zygomatic arch. Now we're below the zygomatic arch. And if you have any sinus sensitivity, you will feel this, I'm sure. Good. Good. And go ahead and release. So those are all acupressure points, really helpful for addressing headache pain. And then all your other massage techniques for headaches can be helpful. So everything you work on for the head, so massaging the scalp, moving the skin of the scalp over the bone, stroking from the midline out to the temples, starting at the crest, right at the hairline, and working your way down towards the eyebrows. And doing this over and over again. So I would repeat this at least 3 times, 3 to 5 times would be good. Good. And then I did a class on TMJ. So sometimes tension in the temporal mandibular joint is causing headache pain. It's referring up into the parietal bones. So pressing on the temporal mandibular joint, you can just use straight pressure in towards the midline of your cranium. And if that's tender, then that may be a sign that is the cause of the headache. So you can go to the TMJ treatment video and watch that for TMJ treatment. Good. And a really nice way to end is to just place a whole hand across the forehead and on the back of the head. And gently, gently, just hold. You don't need to press or squeeze. And breathe. Nice deep breaths. You can allow the eyes to close. And I'm going to switch my hands. So which hand I had in front, I'm just going to move it to the back. Just reversing the polarity on those hands and the energy between them. We're directing energy between our hands, front and back of the skull. Take a deep breath, letting out a big sigh on the exhale. And just release. Now, sometimes tension, we worked gallbladder 21, is caused by the shoulders being up kind of by the ears. So you can invite yourself and your client to do some shoulder shrugging. Inhale, exhale. And then squeeze them up and let them go. Roll them back a couple times. And now just notice how you're feeling in this moment. How did that headache treatment affect your body and affect your mind? All right, that's what I have for you today. Thank you for joining me. Any questions, feedback? You're welcome to turn off your microphone and offer that.